मारूफ नाम वकार अली खान पेश करते हैं प्रोग्राम पाकिस्तान से आगे। दुनिया भर में आबाद पाकिस्तान के बारे में भरपूर रिपोर्ट, समाजी फलाही, इस्लामी, सियासी, साइंस, सेहत और JFK के साथ प्रॉपर्टी पर खुसूसी रिपोर्ट। देखिए पाकिस्तान से आगे वकार अली खान के साथ दुनिया भर में आबाद पाकिस्तानी पाकिस्तान की तरक्की के लिए सरगर्म। देखिए प्रोग्राम पाकिस्तान से आगे वकार अली खान के साथ अमेरिका, यूरोप, अफ्रीका, मिडिल ईस्ट, साउथ एशिया की तरक्की में पाकिस्तानियों का हिस्सा। देखिए प्रोग्राम पाकिस्तान से आगे। देखिए बैनुल-अक़वामी मंजर में पाकिस्तानियों का फलाही, समाजी, सियासी, मुआशी, तिजारती सतह पर पाकिस्तानियों का हिस्सा। वकार अली खान के साथ प्रोग्राम पाकिस्तान से आगे।
अस्सलाम वालेकुम। OPTV ग्लोबल टीवी नेटवर्क आपको खुश आमदीद कहता है और आज भी मेरी बड़ी खुशी है और ये बाई से मुसरत है मेरे लिए कि जिसको मैंने कांटेक्ट किया, रब्ता किया, वो सब लोग आज मौजूद हैं हमारे इस जूम वेबिनार के अंदर। और ये काबिल सताए की बात है कि आपने अपना कीमती वक्त निकाला और पाकिस्तान के लिए और उन लोगों के लिए जिसको आप सेहतमंद देखना चाहते हैं आज इस पैनल में मौजूद हैं। और आज इस शहर के बल्कि मुल्क के मायनाज एक्सपर्ट्स और प्रोफेशनल कामयाब तरीन लोग आज मौजूद हैं इस वेबिनार के अंदर। मेरी तारीफ मैं क्या करूं, यू नो एवरीबॉडी, आई एम एग्जीक्यूटिव प्रोड्यूसर सफीर पाकिस्तान 14-15 years and I have a very major role with Apna all the time, almost 25 years. I work with Apna every president and I travel with them, Pakistan, other countries, India as well, you know. तो ये बड़ी खुशी है मुझे। और आज एक्चुअली मीटिंग का मकसद ये था कि आयशा अली को हमें बॉस्टन ले जाना था, वहाँ की बिजनेस कम्युनिटी और फिजिशियन कम्युनिटी से मिलाना था और डॉक्टर सुहेल मसूद ने उनको ऑफिशियल इन्विटेशन दिया था, लेकिन ड्यू टू द कोविड-19 ये नामुमकिन था। तो हमने इस मीटिंग को फिर ऑन किया जूम पर ऑन द रिक्वेस्ट ऑफ द आवर बिलव्ड काउंसिल जनरल आयशा अली साहिबा, जो कि बड़ी सीनियर डेवलपमेंट है, दिल्ली में भी रही हैं 3 साल और चाइना अफेयर्स की भी डायरेक्टर रह चुकी हैं और आजकल न्यूयॉर्क में काउंसिल जनरल हैं। बहुत ही एग्रेसिव और बहुत ही कोऑपरेटिव पर्सनालिटी इनके साथ इनके कमिश्नर काउंसिलर जनाब तलत साहब मौजूद हैं। ठीक है, तो इससे पहले कि हम मीटिंग का आगाज़ करें, हम चाहेंगे कि हम आज की जो कीनोट स्पीकर हैं आयशा अली, उनको हम पहले चांस देंगे, लेकिन इससे पहले मैं चाहूँगा कि राउंड अप इंट्रोडक्शन हो जाए। आई एम गोइंग टू स्टार्ट विद नाइद उस्मानी।
अस्सलाम वालेकुम एवरीवन। मैं पीडियाट्रिक हीमेटोलॉजिस्ट ऑन्कोलॉजिस्ट हूँ और इस साल अपना की प्रेसिडेंट हूँ। पाकिस्तान से मुझे बहुत वालिहाना प्यार है और मैं पाकिस्तान 5 साल रह के भी आई हूँ। उधर पीडियाट्रिक ऑन्कोलॉजी यूनिट शौकत खानम में मैंने इस्टेब्लिश किया था और इस साल हमारा सारा जो इनिशिएटिव्स हैं वो सब पाकिस्तान में हेल्थ केयर इम्प्रूवमेंट के इर्द गिर्द हैं और ऑब्वियसली कोविड-19 के लिए भी अपना ने $1 मिलियन से ज़्यादा रेज किए और पाकिस्तान में 2/3 स्पेंड किए ऑन PPEs, ऑक्सीजन सप्लाईज एंड food aid across all of Pakistan. So I'm very proud to represent Apna here. Shukriya.
Thank you very much. Now I'm going to be asked Dr. Suhail Masood, the host of the...
I'll keep the eye on my ball.
जी, डॉक्टर सुहेल मसूद साहब।
अस्सलाम वालेकुम सब लोग। तो मैं सुहेल मसूद हूँ, मैं CEO हूँ काबा फ्यूजन का, जो कि होम इन्फ्यूजन कंपनी है नेशन वाइड। It's the largest independently owned stock market company, so it's a privately held company. हम लोग घर पे मरीजों को इंट्रावीनस ड्रग्स और नर्सिंग प्रोवाइड करते हैं। हमारे ऑफिसेज जो हैं वो 17 स्टेट्स में हैं, लेकिन हम ऑलमोस्ट ऑल 50 स्टेट्स को प्रोवाइड करते हैं सर्विसेज। तो घर पे मरीजों को इंट्रावीनस ड्रग्स, एंटीबायोटिक, TPN, पेन मैनेजमेंट, कीमोथेरेपी, intravenous immune globulin, which is our expertise in neuromuscular diseases, वो हम प्रोवाइड करते हैं। हमारी नर्सेज मरीजों के घर पे जाती हैं। हमारी 2 कॉर्पोरेट ऑफिसेज हैं, 1 वेस्ट कोस्ट में जो सरिटोस कैलिफोर्निया में है और 1 ईस्ट कोस्ट में जो कि लेक्सिंगटन मैसाचुसेट में है। मैं वेस्टर्न में रहता हूँ अपनी बीवी के साथ जो कि सीरियन है, और मेरे 2 बच्चे हैं, लैला शी इज 28 और सन ओमर जो 24 है, and Omar has Down syndrome and I have a very special place for him. It's a comic book store in Lexington, Massachusetts, which is very well known in the local community. So
thank you very much, Dr. Saab. Welcome on board. Now I'd like to roll into the Shahid Khan Saab from Boston.
अस्सलामुअलैकुम एवरीबॉडी, मेरा नाम शाहिद अहमद खान है। मैं पाकिस्तान का ऑनरी कौंसल जनरल न्यू इंग्लैंड स्टेट से सर्व करता हूँ और इसके साथ मैं रिन्यूएबल एनर्जी बिजनेस में हूँ। हमारी जेवी पार्टनरशिप सैफायर ग्रुप के साथ है पाकिस्तान में, एंड वी हैव द लार्जेस्ट विंड एनर्जी farm in Pakistan.
And he's also a big political background with the John Kerry. He was a financial advisor. He's still an advisor to the Joe Biden campaign.
I also serve on Biden's campaign. I'm part of the foreign relations team as well as national finance team.
Okay. Now I'm going to be rolling with the Dr. Nathar Qureshi, the former president of the APNA. He's the CEO, chairman of the QREX. He's a very aggressive, mutaharrik शख्सियत है और मेरा इनका साथ बहुत रहा है अपना के अंदर। डॉक्टर नसर कुरैशी साहब।
Shukriya Waqar Saab, thank you for inviting me. So as a background, मैं pathologist हूँ and I'm the medical director of QREX Pathology Services. I've had the pleasure पहले to serve as the president of APNA, and I'm the incoming chair of American Pakistan Foundation. And currently I'm on the forefront dealing with COVID. We do provide testing for COVID, especially for surgery centers who have patients who are scheduled and need results within 24 hours. I've been involved at various levels with Pakistan, both with the previous governments, not at all with the current government, which Nahid Usmani has been involved as the current president, has done some wonderful work, but do understand the landscape of healthcare in Pakistan to a certain extent. Bahut shukriya.
Thank you very much, Dr. Nathar Qureshi from New Jersey. And now I'd like to be rolling with the Dr. Sana Khan, MD, PhD, neurophysicist. Dr. Sana Khan.
Assalamualaikum. Waqar bhai, how are you guys doing? Thank you so much for having me. I'm just, I've been on another webinar talking about COVID-19 and actually been broadcasting it to Pakistan as well. So a lot going on in the world. So I'm a radiologist and I own imaging centers in California and in Texas. And alhamdulillah, I think, again, thank you for putting this together. It really it's a valuable service that you're providing. And it's always great to see Sohail bhai anyway. So, I'm here, whatever we can do to help, inshallah. Happy to do so.
Thank you, Dr. Saab. Thank you very much. Now I'm going to be rolling with Dr. Ijaz Ahmed, Chairman, ABPAC, and top cardiologist, nuclear cardiologist, Dr. Ijaz Ahmed Saab.
Assalamu alaikum, everybody. Thank you very much, Waqar Saab. We're very happy and proud to be with you in this project. I'm a cardiologist in New York, and also I'm building a hospital in Gujranwala, around 250 beds hospital, which will be mostly focused on cardiac and other care. And I want to know more about this project, and I'm happy to be part of it. Thank you very much.
Thank you, Dr. Ijaz Saab. MashaAllah, you're doing a wonderful job on the both background, the health and the politics in New York, and it's excellent job you're doing. We all salute you. And if there is Mr. Nafis Nagi, Dr. Nafis Nagi.
Mr. Nagi साहब अभी तक login नहीं हुए।
अच्छा, Dr. Amir Ehsan from San Antonio, another top genetic pathologist, very renowned, Mr. Amir Ehsan.
Assalamualaikum Waqar bhai, or first of all, congratulate in arranging again one of the wonderful program with all the movers and shakers of our community. मैं आमिर एहसान, मेरी graduation Dow से है. I'm from Karachi, And professionally, I'm a molecular pathologist and hematopathologist, headquartered in San Antonio. मैं academically affiliated हूँ as a professor with University of Texas और VA hospital से as a chief of pathology. Nationwide, I chair the genomic program for the VA hospital across all states. मेरी अपनी private lab भी है, CorePath, जो I'm the CEO and the president, has presence in 20 different states. We have expanded in Mexico as well, so we have gone national. Community side pe, I chaired the medical, the board for the Islamic Society with emphasis on youth leadership. And I'm also politically involved in local community with local congressmen and senators. Thank you.
Thank you very much. Jamal Khwaja और कौन है on board?
Sir, you can have Isma Qayyum next.
Okay, I would like to invite Isma Qayyum. She recently came from Pakistan. She was serving on a very special project of infectious disease on HIV. इस सिलसिले में वो गई हुई थी वहाँ पे काफी काम किया और अभी she returned from Karachi, Pakistan, and she is also from Boston. Isma Qayyum.
Can you hear us?
Should I start again?
Yes, please.
Okay, all right. So the third time is always a charm, I would say. So I'm Asma Qayyum, and I just wanted to thank you for this wonderful project in which you guys are involved, and hopefully my involvement will be useful. I am an internist and also have a background in infectious disease. I practice in the greater Boston area. So Naheed is not too far from where I am, and we have served together. Peripherally, my involvement with UPNI was as being the president of UPNI, which is a local chapter of the New England, in the New England area. Things that we have done are quite a few. Some are politically inclined, and some were more focused towards what things happening in Pakistan as far as infectious disease is concerned. That somehow got pushed back because of COVID. There were a number of things that were planned, but certainly I must correct, I wasn't in Pakistan currently for that purpose. That didn't materialize, but certainly we are very much interested in another group of physicians along with me who would like to move this forward, and we will be talking to Dr. Usmani regarding that. So briefly, that's where I fit into this webinar with you guys. I'm happy to be here.
Thank you so much. Waqar bhai, we can invite Mr. Adil Najam, Mr. Talat. ये दो लोग अभी invited नहीं.
Dr. Nadeem, Adil Najam, introduction. Adil Najam साहब, you are on board.
बहुत शुक्रिया वकार साहब, बहुत शुक्रिया. मेरी आवाज भी म्यूट पे बेहतर होती है और मेरा तारुफ भी म्यूट पे बेहतर होता है. सो बहुत शुक्रिया फॉर दैट. मेरा नाम आदिल नजम है. मैं पढ़ाता हूँ. आई एम अ प्रोफेसर एट बॉस्टन यूनिवर्सिटी. आई आल्सो सर्व एज द डीन ऑफ आवर स्कूल ऑफ इंटरनेशनल अफेयर्स. उससे पहले आई वाज वाइस चांसलर ऑफ लम्स, लाहौर यूनिवर्सिटी ऑफ मैनेजमेंट साइंसेस. यहाँ बहुत सारे मेरे दोस्त हैं, बहुत सारे फिजिशियंस हैं. डॉक्टर मैं भी हूँ, लेकिन मैं किसी का भला नहीं कर सकता, तो मुझे आप मरीज ही समझे.
एनवायरमेंटल इंडस्ट्री में आपका बहुत बड़ा रोल है. ठीक है, गो अहेड. You want to say anything else or more? Thank you very much, Dr. Adil. Nadeem Salim.
Assalamualaikum everybody. I am a partner actually in a financial planning firm called United Wealth Group. We are, alhamdulillah, actually a full service financial planning firm. We are CFP and fiduciaries. We manage close to 400 million between me and my partners. And I'm actually fortunate enough that quite a few of you guys on this panel are friends, dear friends and clients. So alhamdulillah, any way I can help, Waqar bhai, I appreciate the opportunity. Thank you.
Thank you very much for underwriting about this project. Now I would like to open very important floor. As you know that Dr. Aisha Ali, we are planning to invite her on Boston, but somehow due to the COVID, we set up this meeting. And then I enjoyed the meeting a little bit out of the Boston to bring more expertise. So now I'd like to request the Consul General of New York, Aishali Sahiba, to overview about what's going on in Pakistan, what are the opportunity, and what are the metrics of the government of Pakistan, and how this group can be helpful. Aisha Ali, Consul General of Pakistan, New York.
वकार साहब बहुत शुक्रिया. I hope everyone can hear me. सबको मेरी आवाज़ सही आ रही है. Thank you so much. Thank you, ladies and gentlemen, for taking your time out to be a part of this webinar today. वकार साहब आपका बहुत शुक्रिया. You have been extremely persistent, and thank you for putting all of this together. I want to thank Dr. Usmani and particularly Dr. Ejaz from New York, and want to recognize बाकी तो वैसे तो सभी हमारे यहाँ पर जो panelists हैं, alhamdulillah, they have played a very important role in Pakistan's COVID-19 response and our efforts to combat this disease. लेकिन ख़ास तौर पे डॉक्टर उस्मानी का और डॉक्टर एजाज का और बाकी लोगों का जिक्र करना चाहती हूँ, who have raised millions of dollars, and they have contributed their time and saved hundreds and thousands of lives in Pakistan. You are, all of you are physicians of Pakistani descent, as well as all other panelists जिनमें से कुछ से मेरी मुलाकात हुई है और कुछ से कोविड की वजह से अभी तक नहीं हो सकी. जब भी पाकिस्तान को आपकी ज़रूरत पड़ी है और कोई भी कभी खुदा नास्ता जिस तरह से कोई नेशनल डिज़ास्टर होता है या कोई कैलामिटी होती है, तो हमारा डायस्पोरा एंड particularly our Pakistani American brothers and sisters हमेशा सफ़े अव्वल में रहे हैं. हमेशा आप लोगों ने पाकिस्तान की मदद की है, जिसके लिए मैं आपकी बहुत शुक्रगुजार हूँ. और हम ये समझते हैं कि आप हमारे लिए एक बहुत बड़ा सरमाया हैं, और हमारे लिए you always give your best to Pakistan, for which on behalf of the government of Pakistan I'm very, very grateful to you. Thank you so much for all that you have done. To be very honest, when I was prepping for this, I just thought कि एक ऐसे पैनल के सामने हेल्थ की बात करूँगी जिन्होंने decades अपनी ज़िंदगी के इस फील्ड में गुजारे हैं, and who are alhamdulillah and mashallah all very, very experienced and are experts and in their own particular fields. So my idea here is not to have a sort of a monologue जिसमें मैं ही बात करती रहूँगी, बल्कि the idea is to have a conversation on a subject that is extremely, extremely important. Also important because we continue to be in the midst of this global pandemic, जो कि अब उसको शुरू हुए भी एक साल हो चुका है, and unfortunately after a few slightly better months दोबारा हमें एक resurgence नज़र आ रही है, especially in the US and in some of the states where we live. So the idea here is to talk about all these issues, and from the government's perspective to give you an overview of the health landscape in Pakistan, basically the infrastructure, and also highlight some of the important initiatives and focus areas of the government. Jahan par government ka in the last 2 years, there has been a particular focus. And also, I want to talk about the correlation between health sector and human capital development and investment. जिसमें पाकिस्तान दूसरे कई ममालिक के मुकाबले में I think हम लोग पीछे रहे, but we need to focus on that. And then obviously the role of diaspora and the role of Pakistani, the role of physicians of Pakistani descent in the US, जिन्होंने हमेशा, as I said earlier, बहुत important contributions की हैं इस field के अंदर. Health sector, health in Pakistan, as you know, is now a provincial subject. And this happened after the 18th Amendment to our Constitution in 2011. So earlier, health used to be a federal subject, but अब वो 2011 के बाद इसको provinces के हवाले किया गया. But we felt even then कि शायद कुछ provinces were not ready to take this huge responsibility right away. So, and there was a gap. Federal ke upar, federal government mein, we didn't have a focal ministry for a few years. So this was rectified in 2013, and now we have a Ministry for National Health and Health Services Regulation and Control, which was set up in 2013. थोड़ा सा उसके बारे में आपको बताना चाहती हूँ कि उसका क्या mandate है. It deals with obviously medical services and frames health policies and the enforcement. It also deals with international agreements, country targets, global health security, and co-finances preventive vertical programs with the provinces. It is also responsible for licensing, registration, pricing, research, surveillance, and standard setting. Previously, sorry, I kind of lost my thought. Provinces, कहना चाह रही हूँ कि provinces इसके अलावा जो सारी चीजें हैं health related, वो provinces का mandate है after the 18th Amendment. As you know, in the provinces, the lowest tier is the basic health unit, and then we have the rural health centers, we have tehsil headquarters, hospitals, then we have provincial district health hospitals, and then we have the teaching hospitals at the top. Challenges तो बहुत रहे हैं health sector के अंदर, and even now after devolution, provinces continue to face several challenges in the health sector. However, the data that I was going through, जब मैं उसको पढ़ रही थी, तो मुझे पता चला कि provinces की per capita spending on health has actually increased after devolution, which means that now provincial governments are taking more and more ownership of the health responsibilities. अगर health status के बारे में federal level के ऊपर अगर आपको बताना चाहूँ तो the government is fully cognizant that access to quality healthcare facilities for the general public is of utmost importance. So one of the most important goals जो federal government के हैं वो ये है कि universal health coverage सबको दिया जाए, and उसके लिए 2030 का हमने एक target रखा है. And toward this end, the government of Pakistan has also become a signatory to the International Health Partnership, IHP Plus, in 2010. And then we published our Pakistan National Health Vision 2016-2025, recognizing universal health coverage as a priority area. In terms of our indicators, थोड़ी सी बात करना चाहती हूँ. Indicators, although I would be the first person to admit that there are still many challenges, but our indicators, health indicators, have steadily improved, and in areas which are of utmost importance. As percentage of GDP, in FY 2019, we spent 1.1% on health, which is obviously बहुत कम है, and I think there is a realization कि इसको ऊपर ले जाने की ज़रूरत है if we are to improve our health sector and health facilities for the people. But when you compare this to 2011, 2012, and the earlier years, it's still an improvement. Some health indicators which I want to particularly highlight for you, which I think are very important. The nutritional status of mothers and children has shown some progress. Stunting, which is a very important focus, and stopping this, which is a very important focus of the government. Stunting rates for children under age 5 have dropped from 44% to 40%. And maternal and child health care indicators have also improved significantly. The maternal mortality rate has improved from 276 per 100,000 live births in 2006 and 7 to 186 per 100,000 live births in 2019. For immunization also, immunization coverage for children aged 12 to 23 has increased considerably over the 5-year span from 54% 64% in 2013 to 66% in 2018. Punjab has a coverage rate of 80% for fully immunized children. Sindh and Balochistan are at 49% and 29% respectively. The World Bank is contributing in a significant way towards this crucial achievement through its National Immunization Support Project, NISP, which has been under implementation since 2016. So some other health indicators, population and growth rate still remains on the high side, but life expectancy at birth, which was 66.8% in 2016, is 67.1% in 2018. Uske alawa under 5 mortality rate, which was 73.8% in 2016, is 69.3% in 2018. Infant mortality rate per 1,000 live births, इसके बारे में अभी मैं आपसे बात कर चुकी हूँ. It was 60.5% in 2016 and now 57.2% in 2018. So some of the indicators, as I said, but our challenges obviously are there, and we need to really focus on them. And unfortunately, we're facing a double burden of disease as per our National Vision Plan. उससे ही कोट कर रही हूँ और आपको कुछ बताना चाहती हूँ कि the burden is higher for the poor people. And many of these conditions we feel can be controlled at a relatively low cost and best practices through primary and secondary care levels. Some of the challenges again, communicable diseases, maternal health issues, and undernutrition dominate and constitute about half of the burden of diseases. In young children, diarrhea and respiratory illnesses remain the major killers. Maternal deaths due to preventable causes like sepsis, hemorrhage, and hypertensive crisis are common. Pakistan is unfortunately one of the very few countries left now where polio is endemic, hepatitis B and C again is endemic, and it affects about 7.6% of our population. Pakistan also has the 5th highest burden of tuberculosis, but largest burden. Non-communicable diseases are also amongst our challenges, along with injuries and mental health issues, which constitute the other half of the burden of diseases, causing far more disabilities and premature deaths among an economically productive adult age group. Population explosion, I talked about it briefly earlier. Pakistan is now one of the 6th most populous country in the world. Decline in population growth rate has been slow, and our current population growth rate of 1.9 per annum is driven by increasing age at marriage in urban areas. Contraceptive prevalence is only 35%. Health access inequities continue, although we are working extremely hard to overcome these challenges. Health system, as you know, in Pakistan is a mixed one. It includes government infrastructure, it includes private sector, civil society, and philanthropic contributors. Unfortunately, private sector को बहुत एक large role play करना पड़ा है in the recent years to fill the gaps. These are some of the challenges जो कि पिछले कई सालों से हमारे सिस्टम के अंदर रहे हैं, और अभी तक इनमें से बहुत सारे challenges, as I mentioned, उनमें कुछ ना कुछ progress रही है, but mostly अभी भी इन challenges का हमें सामना है. अगर मैं आपको recent FY 2019 की कुछ मिसालें दूं तो I think there is a realization on part of the government कि अब एक नए thinking की और एक नए सोच की ज़रूरत है इन challenges को overcome करने के लिए. सो इस सिलसिले में और इस सोच के तहत बहुत सारे नए इनिशिएटिव्स गवर्नमेंट ने इंट्रोड्यूस करवाए हैं, जिसमें सेहत सहूलत प्रोग्राम जो है वो एक फ्लैगशिप प्रोग्राम है ऑफ सोशल हेल्थ प्रोटेक्शन, and it is a milestone towards attaining universal health coverage. और ये पहली दफ़ा ऐसा हुआ है कि हमने इंश्योरेंस और जो लोग पॉवर्टी लाइन से नीचे रहते हैं उनके लिए एक ऐसा प्रोग्राम शुरू किया गया है. It wants to ensure that the underprivileged citizens across the country get access to their entitled medical health care in a swift and dignified manner without any financial obligations. So currently the program is covering indoor patient services only, but will be extended to cover outdoor patient services as well. Government has also focused a great deal on dengue control, and along with the provincial health departments, it is implementing dengue control measures with the support of World Health Organization. ये quickly अगर मैं इनकी डिटेल्स में जाऊं तो फिर हमारा इस पे बहुत ज़्यादा टाइम लग जाएगा, लेकिन I just want to quickly highlight the initiatives and the areas where the government is focusing so that we can have a conversation and an understanding of where the priorities of the government are. So सेहत सहूलत program, as I said, dengue control के बारे में बहुत काम हो रहा है. Then there is एहसास program and family planning and primary health care program, which has been introduced by the government in order to control the high fertility rate and to bring it down so that our resources can be, हम उनको उन जगहों के लिए allocate करें जहाँ पर उनकी ज़्यादा ज़रूरत है. Our immunization program has been expanded, so we have an expanded program for immunization now. इसके अंदर typhoid का भी introduction है. A lot of international donors are helping us with our expanded program for immunization. As I said, unfortunately, Pakistan is one of the few countries जहाँ पर polio endemic है. So polio की eradication के लिए भी government, both at the federal level as well as the provincial governments, have their polio eradication initiative program, PEI. और कोशिश ये है कि इसको जल्द से जल्द ख़त्म किया जाए. Then we have safe blood transfusion services program, malaria control program, tuberculosis, as I said, कि हमारा 5th highest number है दुनिया में. AIDS के ऊपर बहुत फोकस है और बहुत काम हो रहा है. Maternal and child health care, मैंने अभी आपको mention किया था. Then cancer treatment, and इस सिलसिले में भी government ने बहुत ज़्यादा recently बहुत steps लिए हैं जिनमें इस चीज़ का एहसास है कि कैंसर is a disease that's spreading very rapidly in Pakistan, और जो कि बिल्कुल last stages पे जिसकी treatment की जाती है, जिसकी वजह से ये इसका एक बहुत high rate है deaths का पाकिस्तान में, और इसको हमने we need to take this extremely seriously, and we need to make the right interventions here. So these are some of the initiatives, the focus areas. COVID-19 के बारे में भी quickly एक बात ज़रूर करूँगी, इसमें add करूँगी कि it has been a challenge for all the governments of the world. पाकिस्तान के लिए भी जब ये February में हमारे मुल्क में पहली दफ़ा इसका केस सामने आया, तो it was a huge challenge for us. And Pakistan being a developing country, एक ये भी एहसास था पाकिस्तान में कि जिस तरह के लॉकडाउन्स बाकी जगहों पे शायद कामयाब हो सकते थे, वो पाकिस्तान में बिल्कुल एक untenable situation create कर सकता था, because the economic needs and the healthcare needs of the people needed to be taken care of both at the same time. So Prime Minister साहब जो है, उन्होंने अपनी एक smart lockdown की policy शुरू की, जिससे जहाँ पर जो areas में COVID-19 के ज़्यादा cases थे, उनके ऊपर focus किया गया in terms of lockdown. And Alhamdulillah, today our situation is, when we compare it to several countries of the world, उसके बहुत सारे reasons हैं, लेकिन वो Alhamdulillah बहुत बेहतर है. और इसमें at the national level we have a committee headed by the Prime Minister, जो कोविड केसेस का और कोविड की सिचुएशन का ऑन अ डेली बेसिस उसका ख्याल रखती है। कमांड एंड कंट्रोल सेंटर इस्टेब्लिश किया गया है ताकि ये सिचुएशन जो है वो उसको हम मॉनिटर करते रहें। और आज जैसे मैंने व्हेन वी वर टॉकिंग इनफॉर्मली अर्लियर, तो पाकिस्तान का जो कोविड-19 का रिस्पॉन्स है उसको दुनिया में काफ़ी अप्रिशिएट किया गया है। And we see even around us in our region that several countries with similar situations and similar population, उनकी COVID-19 की unfortunately जो situation है वो काफ़ी हमारे मुकाबले में worse है. So several important initiatives taken by the government at the right time, I think, have contributed greatly to the situation in which we find ourselves today in terms of COVID-19, which is relatively दूसरों के मुकाबले में बहुत बेहतर है. Then also want to talk a little bit about human capital development and health as human capital development. हमारे मुल्क में इसके ऊपर initially बहुत ज़्यादा काम नहीं किया गया, and historically we have invested very little in human capital development. For us, actually, it can be a huge dividend because ours is a very young population और हमारे पास एक youth bulge है. So अगर हम ये health interventions at every stage of life cycle अगर हम ये शुरू करें और इसको एक बहुत comprehensive तरीके से और एक policy के तहत आगे चलाया जाए, तो I think हमें अपनी ह्यूमन कैपिटल डेवलपमेंट में इस सिलसिले में बहुत मदद मिल सकती है. द रोल ऑफ डायस्पोरा, जिसके लिए वकार साहब आपने आज के वेबिनार का भी एहतमाम किया, उसमें हमेशा से हमारे जो पाकिस्तानी फिजिशियंस हैं उन्होंने बढ़ चढ़ कर, एज आई सेड अर्लियर एज वेल, पाकिस्तान के हेल्थ सेक्टर में अपनी कंट्रीब्यूशन की है. और ये कंट्रीब्यूशन मुख्तलिफ तरीक़ों से हुई है. कभी सोशल वेलफेयर प्रोजेक्ट्स के ज़रिए से किया गया है, हॉस्पिटल्स में कंट्रीब्यूशन की गई है, चैरिटी के तौर पे इसको किया जाता है, कोई कैलामिटी हो, कोई पैंडेमिक हो, उसके दौरान किया जाता है. आई एम वेरी ग्रेटफुल टू ऑल ऑफ यू फॉर दैट. And I look forward to your continued contribution in the health sector. लेकिन I think कि जहाँ COVID ने बहुत सारे हमारे लिए challenges create किए हैं, वहाँ पर एक opportunity भी है. Even though we cannot meet in person or travel is restricted, but through technologies, I think we can continue to make our contribution. And I think where diaspora and Pakistani physicians can make a real impact is also through these technologies in terms of, teaching, in terms of transfer of technology ki baatcheet, and in terms of educating, sharing best practices. This will be, I think, an important contribution. Already आप सबका अपने medical colleges और अपनी alumni associations के साथ एक बहुत गहरा ताल्लुक है और आप नीड्स बेसिस के ऊपर भी उनकी मदद करते हैं और एज सस्टेन पॉलिसी एफर्ट्स भी ये एफर्ट्स जारी रहते हैं. That has contributed significantly, and I think in the future as well, हम मिलजुल कर we can make a very meaningful contribution in this sector. गवर्नमेंट का मैंने आपको एक ओवरव्यू दिया है. गवर्नमेंट के एक जो एरियाज हैं जहाँ पर फोकस है, जहाँ पर जो न्यू इनिशिएटिव्स हैं उनको मैंने हाईलाइट किया है. एंड आई थिंक देयर इज प्लेंटी ऑफ रूम इन ऑल ऑफ दिस फॉर ऑल ऑफ अस टू कम टुगेदर and to take this initiative forward and continue to make the useful contributions that have been coming from everyone. I'm very grateful to all of you for your patience and for being here at this platform, all of us together, and look forward to hearing your views. Bahut shukriya. Thank you so much.
Thank you. Thank you very much, everyone, and very detailed and very comprehensive report by the Consul General Aisha Ali. And अब मैं चाहूँगा कि डेफिनेटली हमारी जो नायब उस्मानी हैं उन्होंने भी हाल में विजिट किया है पाकिस्तान का, और ये तो एक आपकी रिपोर्ट है गवर्नमेंट साइड की, जो गवर्नमेंट ये बहुत चीज़ें कर रही है, लेकिन उसमें हुआ ये है कि जब से ये ड्यूटीज फेडरल गवर्नमेंट को दी गई हैं तो उसमें काफ़ी लैकिंग हो रही है और काफ़ी उसमें प्रॉब्लम एंड इश्यूज आए हैं, और मैं समझता हूँ कि फेडरल को ये टेक ओवर करना चाहिए, ये हमारी भी गुजारिश है। तो डॉक्टर नाहिद उस्मानी आज मौजूद हैं अपनी एक प्रेजेंटेशन के सिलसिले में, और हमने इसको डेफिनेटली 5 to 6 मिनट का रखना है। और डॉक्टर नाहिद उस्मानी, यू आर ऑन बोर्ड, प्लीज।
जी, अस्सलाम वालेकुम। थैंक यू सो मच वकार साहब। Thank you so much, Miss Aisha Ali, Consul General, Pakistan. I would like to share my screen. So, as Miss Aisha Ali presented, primary care is Pakistan's critical need. We have to develop primary care to address all the healthcare disparities that exist in Pakistan. 207 million population, average age 66 to 68 years. 5-year mortality rate is very high, 8.1%, and health spending is low. But what is most important is healthcare allocation. 70% of all the healthcare is spent in Pakistan in tertiary care, and less than 0.1% is spent for maternal and child health. And little bit is spent on preventive care. And as you heard, the healthcare indices for Pakistan are one of the worst within our region. Dr. Aisha Ali, Miss Aisha Ali went over some of the things, but we have very high neonatal mortality, infant mortality, maternal mortality is extremely high. Our birth rates are tremendously high. Half our population is either underweight or stunted, and almost all children and pregnant women are anemic. So the health challenges, as described previously, are communicable diseases, maternal child health, and nutrition. That's half the burden of the national health disease status. And polio, 7th highest tuberculosis burden globally, hepatitis B and C, 1 in 10 people almost has hep C, malaria, and then multi-drug resistant typhoid. A third of the mothers two-thirds of the mother don't have any antenatal care. There's very low contraceptive prevalence. And at least the data says only more than half the children are not fully immunized. About 40% of our population smokes. About 12% of our population above 25 years of age has diabetes. 29% has high blood pressure. And in 2012, 3 major causes of death were ischemic heart disease, pneumonias, and stroke. Really high percentage when you compare it to the global burden. Most of the deaths has been due to ischemic heart disease, stroke, preterm birth complications, and chronic lung disease. So we don't need to look far and compare Pakistan. We have to other developed countries. We have to look locally. And I would like to bring your attention to comparison of health status in Pakistan to Sri Lanka, where the life expectancy is 74.2 years. Infant mortality rate is 8.2 versus 69 of Pakistan. Under 5 mortality is low. Maternal mortality rate is only 29, and the population growth rate is 0.76. When you compare it to Pakistan's health statistics, they are so far ahead. Why? So, just a minute, where did that? Oh, so I think the major thing is that they invested in primary care. Instead of spending 1% of the national health expenditure on of GDP on health, they spend around twice as much, 2%. but their whole focus is developing primary care. And their primary care focuses on preventative care, on immunization, on prenatal care, on nutrition. And that has changed all this health indices to where we would like Pakistan to be. So APNA in January decided to have to look at it and see how we can improve primary healthcare. Because at the end of it, unless Pakistan has primary healthcare universally available, we cannot improve. About 14,000 Pakistani physicians, Pakistani educated physicians in US are in the health industry, and 43% are in primary care specialty. So what APNA did this year was that it took, APNA Merit, the Medical Education, Research and Transfer of Technology Committee. We formed a family medicine subcommittee, and we started an initiative with the international conference in March in Pakistan, and then launched a family medicine initiative. We didn't do it by ourselves. We took the Pakistani physicians of UK, Northern Europe, and Australia together with family medicine committee and organizations in Pakistan. And we started a national initiative. And I'm very proud to say that we have started a year-long Merit Family Practice course that we are delivering online that was inaugurated in October 2020, which will contribute to the primary care competencies in Pakistan. Usually, primary care in Pakistan is delivered by general practitioners who do MBBS and then put up their board as a general practitioner. This will increase the education and the level of competency in Pakistani general physicians and will lead to an academic primary care driven curriculum for all medical schools and postgraduate medical education. APNA has done this by inaugurating an APNA Academy, an online, comprehensive online learning management platform where we are doing these courses, including multiple other training programs, Ms. Aisha Ali, for stroke, which is such a high morbidity in Pakistan, for a number of other nursing specialty training, because the nurses there require a lot of training. We are going to be delivering multiple courses on different groups. Emergency medicine is a specialty that we think in Pakistan is lacking, so we are going to be developing that course. And we are really looking forward for APNA to participate in improving health education in various specialties in Pakistan. But our main focus is, if we can't change the primary care in Pakistan, none of the health indices will improve. And the government of Pakistan has to invest more than what it is investing right now, both provincially and nationally. And we will be there as APNA physicians. We will be there to partner with Pakistan in all these endeavors. Thank you.
Thank you. Thank you very much. Thank you very much, Nahid. Very comprehensive. I'm very proud of you. You have done a lot of work and very detailed. That's all we need to educate our officials, our people. Okay, what's going on the health sector. Jamal Khwaja is one of my friends. He's always with us on Zoom meetings. This is our second largest Zoom meeting on health. First, we have a trade and investment. Jamal is an investor and financial guru in the real estate. Thank you, Jamal Khwaja, for your contribution all the time. Now, I'd like to invite the meeting took place because of Dr. Suhail Masood Saab. Dr. Suhail Masood Saab, you listening everything, and what's your take on it, and how you can be helpful, because your company is the largest in IVIG, immunoglobulin services, neuromuscular disorders, and you serve oncologists, you serve many areas of the infusions. So please give your opinion. Dr. Sohail Masood.
Thank you, Waqar bhai. Assalamu alaikum, Aisha Ali. Sana bhai, it's always nice to see you. I love your beautiful home in the driveway. Basically, हमारी जो home infusion business है, वो क्या है? वो basically जो मरीज घर पे हैं, we try to make sure that they're compliant with their drugs, and they have the services available. जो डॉक्टर उस्मानी कह रही थी कि प्राइमरी केयर जो portion है, a lot of that, those kind of services can be done in primary care setting outside of the hospital, keeping the patients healthy and making sure that जो immediate needs हैं वो मरीजों को available हों. As we are looking at COVID-19, we also know कि भाई जो hospital में या clinical setting में जो मरीज जा रहे हैं, there is more chances of them getting exposed to COVID versus patients who are staying home and getting the infusions. So the way I look at it, home infusion has a major role to play in the coming years as these pandemics may come one after another. We don't know if it's from global warming or is it because it's just the population of Earth is more than what Earth can sustain. So I think that home infusion, if it can be expanded into Pakistan, especially it can be started in a bigger city or a town. Let's say, since I'm from Lahore, I can tell you, in Lahore, let's say somewhere we started and it started on a local basis and see how we can maintain the patients out of the hospital by providing them care when it's needed, making sure that the nurses are going to patient homes and they are monitoring their progress. All these kind of drugs that right now patients have to go to the hospital to get it done, they can be done at home, and only true emergencies should end up at the hospital. तो उससे क्या होगा कि आपके hospital beds जो हैं, they will be released from patients who really don't need to be in the hospital. Second thing is that as they're not coming to the hospital, there is less crowdedness in the hospitals. And so I believe, I'm a firm believer of home infusion. This industry started 30 some years ago, and I've been involved with this industry since then. And with having all the technology available to us, either the infusion pumps or outpatient MRIs and X-rays and labs and everything else that we're talking about, you can really keep patients healthy at home. I cannot talk too much about the villages and faraway lands because I don't even know how the healthcare is provided to those poor folks. But at least in the cities, if we are focusing on maintaining the health and welfare of patients outside of the hospital setting, we can do it 1/10 of the cost. And we can provide it very safely by nurses going to patient homes and infusing the drugs. It can be your iron deficiency, it can be your vaccinations, it can be your chemo drugs and pain management and all kind of things जो हमारे अभी अस्पताल में मरीज जाके लेट जाते हैं पाकिस्तान में और उनको ये दवाइयाँ लगती हैं, वो हम सब दवाइयाँ जो हैं वो बाहर उनको प्रोवाइड कर सकते हैं और घर में हॉस्पिटल में सिर्फ इमरजेंसीज आएँ और वो I think that will be one of the ways to save cost. And I'll be more than happy to do जो भी मैं कर सकता हूँ.
Thank you, Dr. Saab. MashaAllah, you are one of the #1 company in home infusion, and you also be very big philanthropist, and you help a lot of in a political arena and religious and diaspora, and that's why I wanted to invite Aisha Ali to your place, and you invite other physicians at your residence. But now we are, MashaAllah, doing pretty well here. So my next guest is also the former president of the Apna. He's been several times in Pakistan, and I've been with him several times in Pakistan, and he has a very good eye what's going on. He's definitely professionally pathologist. Dr. Qureshi Saab, you are on board.
Thank you so much, Waqar Saab. Thank you, Council General Aisha, for wonderful input, and it's heartening to see there is a progress in Pakistan, and Nahid for the wonderful work that Apna has done this year. And there are a lot of people much more qualified than me on board for today's meeting, and I'll try to be short. I would like to address some of the points which the Council General had brought up and Nahid reiterated. So it's heartening to learn, but of concern when we speak about communicable and non-communicable diseases, and the focus remains on treatment. तो जब आप बात करती हैं या पाकिस्तान में आज बात हो रही है सेहत सहूलियत की, and you mentioned that it is for inpatients, let's recognize for a fact that Pakistan has the lowest number of beds anywhere in the world per 1,000 population. It's 0.4. Japan, which is an amazing number, is 14. And yes, we agree, India is just right there. And the example of Sri Lanka and Bangladesh that you gave are something that we should be targeting on. Magar, by the time our population reaches there, it's usually a bit too late. Communicable disease, non-communicable diseases ke andar breast cancer ki prevalence is extremely high. We lose a lot of lives because of that. And preventive measures for that or other diseases, which would be early screening and early treatment, amount to nearly zero in Pakistan. So we really have to change the focus on those. Communicable diseases may, again, hepatitis C, the last government's focus was entirely on treatment, and big banners were flown कि जी हम antiviral Pakistan में बना रहे हैं. That is not going to change anything. And if it changes anything, the time span to change that is too long. And when we talk about prevention and very basic preventions, preventive measures, let's talk about Hep C, hepatitis C. It's not just blood transfusion, it's a lot of things. And we haven't been able to impose, despite the fact that हर health minister or health ministry or government को ये बात पता है कि the major transmission is happening at the level of the syringes and needles. So एक वो focus somehow or the other has to change. और जहाँ तक budget का ताल्लुक है, some of these things do not require a large infusion of money. You can get a larger return on investment than low investments and can be achieved. But there has to be a will. हमारी बदकिस्मती ये है कि पॉलिसियाँ बनती हैं हर हुकूमत के साथ 5-year plans, 10 years plan, and 20-year plan, and the UN goals, etc., but implementation nahi hoti. And unfortunately, there is no continuity between change of governments. And how to change that and defeat it, I really have at odds with that, and I don't know the answer to that question. So I just gave an example of a communicable and a non-communicable disease, and as Nahid said, aapne bhi kaha ki prevention is so much better than cure, and you have the right population, as Council General you said, a younger population, done at the right time. The down the line burden on the healthcare system can be reduced tremendously. बात बार-बार आती है contribution of diaspora की. Diaspora is not the government of Pakistan. Diaspora cannot do anything unless you have an infrastructure. An infrastructure that diaspora can consult and feed into. जहाँ तक चैरिटी की बात बार-बार आती है चैरिटी की, देखिए डायस्पोरा ने और पाकिस्तान में चैरिटी ने बहुत सारी 1.5 इंच की मस्जिदें बनाई हैं, which are of great laurel and tribute to the country and to those people who have done it. However, जब तक infrastructure आप नहीं provide करेंगे, which can be fed and strengthened, those efforts remain 1.5 इंच की मस्जिदें. And that is why we don't see a major effect of it in the healthcare of Pakistan. ये आज से नहीं हो रहा है, 20 साल से 30 साल से हो रहा है. I have seen it in my professional career that the charitable contribution and the contribution from people inside and outside of Pakistan is tremendous in dollar amount and in effort amount. अगर आप उसको एक जगह करके अगर आप लिखना शुरू करेंगे क्या है, but it has never gotten the infrastructure from the government of Pakistan to feed into, which could multiply the effect tremendously. that comes to my last point, that we have to learn to develop an infrastructure where there is a public-private partnership which can be fed into. Jahan bhi, and without being in any manner bringing in any government or parties, Punjab did have or produce in the last government a public-private infrastructure which worked. We saw the effects of it, and I think this government and future governments, it really doesn't matter. Healthcare policy should not be dependent on any government and who is on power. It has to find a way of continuity. And if this government can achieve that, it could have achieved tremendous amounts of things. Or my people who follow me in 2030 having the same Zoom or some other seminar would not be talking about 2040 and 2050 goals. So if we want to achieve that, some of these should be taken into account. But thank you very much, Waqar Saab. I'd love to listen to the very learned panel that is here today.
Thank you very much, Mr. Nasser Qureshi. You always very positive, and you're always ready to help your country, Pakistan. You serve Apna very well. Now I'd like to bring a very, very important person on the platform, Mr. Adil Najam, because there's so many diseases also related with the environmental issue. Okay, smoking, hepatitis C or B, whatever, lungs disease, tuberculosis disease. इसका ताल्लुक environmental से भी है, water pollution से भी है, sewage system से भी है, air pollution से भी है. So I would like to invite Mr. Adil Najam Saab on board.
बहुत शुक्रिया वकार साहब. Thank you for that. I think there are far more important people here who I would like to listen from, and that is why I'm here, and I'm very grateful to the Consul General for her views, and other people have made very important points. Because there are so many friends, I hope they will not mind my saying so. If we think about कि diaspora क्या कर सकती है, तो I think that question needs to be asked very seriously. एक तो ये है कि I think there's a lot of good things, and I hope they continue, and I hope they remain. It has been a very nice surprise to see कि पाकिस्तान के जो numbers have stabilized the way it is. I think for a long while we will try to study and figure out कि असल में हुआ क्या. How did this happen? What did this happen? Was it the pathology? Was it the condition? Because I think that is a question जिसका science को भी interest है और policy को भी interest है. लेकिन एक बात मैं कहूँगा कि हमारे एक, as Aisha had mentioned, the health minister was appointed and a very competent person. And again, मैं किसी की personality की बात नहीं कर रहा, ना politics की बात कर रहा. But the way he had to be removed in the middle of this, मेरे ख्याल में हमारे लिए सवालिया निशान उठाते हैं. मैं बिल्कुल पॉलिटिक्स की बात नहीं कर रहा, राइट, कि एक तो मिडल ऑफ क्राइसिस है. दूसरा, जो आप डायस्पोरा की बात कर रहे हैं, उसका रीजन जो था वो एक पार्टली ये था कि जनाब ये बाहर से, right, and the type of politics that generated. So if we are going to be serious about the question of the role of any diaspora in any country, then I think हमें इस सवाल से भी कोई थोड़ी सी पीस करनी पड़ेगी. We'll have to figure this out. और ये डायस्पोरा को भी समझना पड़ेगा और कॉम को भी सोचना पड़ेगा. अगर आप अगेन मुझे इजाजत दें, आई होप आई एम अमंग फ्रेंड्स, आई थिंक जब पाकिस्तान में हुकूमत हो या दूसरे हो सोचते हैं कि ये डायस्पोरा कंट्रीब्यूट करें, तो आप लोग जी जो मर्जी समझ लें, उनका मतलब ये होता है कि यार तुम्हारे पास पैसे बड़े हैं, जरा मैनू भी दे दो, या आपके पास कोई और रिसोर्सेज हैं, ताल्लुकात है, मुलाकातें करा दो. एंड फ्रैंकली फॉर मैनी जो यहाँ होता है, वो भी एक अर्ज होती है कि जब मुल्क से बाहर आए हूँ, मेरी जो सक्सेस है वो वहाँ नजर आ जाए, या कोई तस्वीर हो जाए. मैं एक्सट्रीम पे जा रहा हूँ. आई एम नॉट क्वेश्चनिंग एनी मोटिव दिस साइड और दैट साइड, बट व्हाट आई एम ट्राइंग टू गेट टू इज कि एज अ मैच्योर डायस्पोरा आई थिंक वी नीड टू कम एंड फिगर आउट कि इसमें पॉलिसी में रोल है क्या. तरक्की किसी भी कौम की जो होती है वो कौम खुद करती है. मुझे दुनिया के 204 मुल्कों में कोई मुल्क मैं नहीं जानता जो डायस्पोरा के बाद पे बड़ा हुआ. सो व्हाट वन कैन डू इज एसेंशियली cheerlead, support, share experiences, be humble themselves. कि कोई ऐसा नहीं है कि सारे अच्छे पाकिस्तानी बाहर आ गए, सारे बुरे वाले उधर रह गए, और ना उल्टा कि जो पाकिस्तानी बाहर आ गया वो गद्दार हो गए. तो जब तक ये हमारी पीस नहीं आएगी, I think a lot of other questions will remain. I know ये आपका सवाल नहीं है, and I apologize, and I hope, मैं इसलिए कह रहा हूँ कि I think these questions we as a diaspora need to confront. कि ये जो symbiosis है, अगर ये symbiosis है, तो इसका बुनियाद है क्या? And in a way, again, I'm not making a political statement, I'm making a political science statement. I'm trying to understand कि एक ऐसी government जो सबसे ज़्यादा diaspora का नारा लगा के आई, if that had to confront the type of tension between अंदर वाला और बाहर वाला, और कौन कितना ज़्यादा पाकिस्तानी है, and uski crisis mein, one of the major casualties was a Dr. Saab who was the least political of the whole lot. So kuch to aur jo diaspora wale the na, who were actually political actors. Then I think we need to figure that question out. So my apologies for this, but as a policy person, I wanted to raise that. Now the larger point, and main bilkul lambi baat nahi karunga, I think because Naheed, Dr. Usmani has said it very, very well. There are fundamental health challenges. There are fundamental health policy opportunities. And those, I think, COVID, agar hamara, if these numbers maintain, then the challenge is कि क्या हम इस अच्छी जो एक situation में इस वक्त हैं बनिस्बत दूसरे मुल्कों के, will we use this to advance in the time जहां पूरी दुनिया बहुत सारे मुमालिक अमेरिका भी फंसे हुए हैं इस मसले में, हमें ये जो respite मिल गई है हम इसे इस्तेमाल कैसे करते हैं? देखिए ना, अगर सारों की इकोनॉमी जो है वो बिल्कुल दब गई, सारों की मुल्क रुक गए, सारों की हेल्थ इतनी बुरी हो गई, सारों की मीनिंग बहुत सारों की, हमारे रीजन में आप इंडिया देख लें या इधर अमेरिका देख लें, सो दे आर स्टाइमिड बैक. नाउ द क्वेश्चन इज कि वो जो ममालिक हैं, पाकिस्तान हो, न्यूजीलैंड हो, वियतनाम हो, फॉर वेरियस रीजंस हु हैव समहाउ बीन स्पेयर्ड ऑफ दिस, हाउ डू वी यूज दिस टाइम? या तो आप लीप फ्रॉग करेंगे कि आप कहेंगे अच्छा यार हमारी खुशकिस्मती थी या अच्छी परफॉर्मेंस थी, उसकी वजह से हमें जो मिला उसमें हमने कैच अप कर लिया उनसे जो बेचारे फंसे हुए, या आप अपनी ताली बजाते रहेंगे और इंतजार करेंगे कि वो आगे आ जाए और हम वहीं खड़े रहें जहाँ पहले थे. That I think is the policy challenge. I've been saying the same thing to my friends in Pakistan on economy, and I would say the same thing on health. I would say the same thing on education or environment. Those are the big questions. So, Waqar Sahab, I hope I have not sort of tried to derail this, but I think you have an amazingly important set of people sitting here. And अगर ये इन बड़े सवालों पे हम नहीं सोचेंगे तो कोई और नहीं सोचेगा.
Very well said, sir. Very well said.
Thank you very much. Now I have a very important person on my team, Dr. Sana Khan. He's been in Pakistan many times. He's a very important personality here in America as well. He's a radiologist, also a neurophysicist, very dear friend of mine, Dr. Sana Khan.
That was embarrassing. So really, I've been listening and taking some notes. Adil bhai, no need for you to apologize at all. I think you're making really, really good points. Dr. Naheed, honestly, I was listening to what you were saying and watching your slides, and Aisha bhai, honestly, it was really. I mean, I'm just telling you guys, you're hitting on some very important points. The question is really the practical application of all of this, right? Because we can all, of course, get together and talk about ideas and thought processes and stuff. So, Aisha, let me tell you something really important. I am a radiologist, and I can tell you right now that I'm going to be out of a job within the next probably 3 to 5 years. Okay, and the reason is because of technology, because of AI. And what's happening in today's world is that AI, in my world, in which I'm working at UCLA, contributing to my own sort of my own industries, I guess becoming less relevant, is that AI is going to take over medicine like you have not seen before within the next 10 years. When you talked about universal healthcare, it really, this is the first time I've heard anybody say universal healthcare in Pakistan. And I'm sure you guys are well aware and stuff. It's the first time that I've heard it, which is today, okay? It's going to be absolutely critical that if you guys are really thinking of that, that you must consider
technology as part and parcel of that solution. Dr. Naid, I'll tell you that, so I'm a charter member for Open in Southern California. And Apna and Open's partnership is going to be so mission critical to accomplish this. And hum log chote basis pe na, we can do maybe little things, right? But if we really marry up medicine with technology, and with the fact that now we have devices that people can wear and communicate with the device at home that then communicates directly with your doctor, and not just with your doctor, with another computer, with a massive computer sitting at Caltech. I mean, at this moment, this is what's happening, which is then analyzing data from so many different clinics at the same time, because the pandemics are just starting. You understand? And the reason Sohail Bhai was mentioning why is this happening and what's coming, it's simply because of the fact that we are all able to travel so much easier to each other, no matter where you are in the world. So if something starts in China, it's going to get in the US within a day or two, not into Pakistan to Dubai, to anywhere. So I have to go to another call. I just finished the seminar. I have to go to another one. But I have to tell you that if there's one thing that you can take, Aisha, from this, is communicate back to Pakistan and to the government, is to work with Dr. Naheed and their team in Apna, who are then really working very closely with Open. You guys, I'm sure you know about Open, right? It's right, of course, it's Pakistani entrepreneur network, but it's a very IT-based system. And what they're doing in San Jose right now in Silicon Valley.
Open also has a New York chapter, which was recently revived, and they are doing a lot of things with the consulate and in terms of IT and other. But
I want medical IT.
You're talking about medical IT.
Yeah, because as a doctor, I can tell you that technology is going to take over so much of the decision making that we as physicians do. Pakistan, the way it is right now, is that just does not have enough physicians, and for the foreseeable future, will not have enough physicians to keep up with the population growth. There's no question about that. So if technology can become part and parcel, and Dr. Naheed, really you're in a position right now, alhamdulillah, let's grant you that position, where you can really, talk about diaspora, right? But what Apna can do for Pakistan is to really help bring medical technology to it, where you can take a physician and make him or her 10 times more effective in what they need to do. And in terms of, home delivery as well, right? That's the way it's going to be, where you can deliver care to people's homes, because you will have detected the problem so much sooner. And early detection is the key to any disease. And I'll end with this, there's a saying in the Western world, right? A stitch in time saves 9, right? Which means if you can get something early enough, it'll allow you to take care of it much better, sooner, and with a lot more effectiveness. So having said that, I just wanted to kind of just really get that point across. I'm sure you guys are already thinking about it, but this is the direction the Pakistan really needs to go in terms of taking care of people healthcare-wise. And you'll be able to get to every gaon. Everybody's got a cell phone everywhere, right? And so this communication, I can tell you right now, this company I'm working with right now in Irvine, that they are basically, their cell phones are communicating based on what people are, just devices that they're wearing, communicating with them. That communication is going to the doctor, the primary care physician of that person, as well as to a centralized computer system at Caltech, which is then monitoring and gathering data on everybody at the same time. The world's about to change like you can't even imagine in the next 10 years in healthcare.
Thank you very much.
I'm done.
Thank you very much. Definitely, you add some valuable thing and technology. Definitely the telemarketing and teleclinic, all this growing field in the medical industry, and the government Pakistan should give an attention to this. And now I'd like to invite, let's say, because we have to talk a lot about health tourism. Okay, every country is opening for the health tourism. Singapore, Thailand, India, and the people investing in their country, building the dialysis center, the cardiac hospital, something like that. So because in America, other countries, very expensive medical treatment. So insurance is sending their patient to India and Thailand and Bangladesh and Singapore to get treatment and get the reduced price for the treatment. That insurance care about it. So I'd like to invite here, Janab, my dear friend, Dr. Ijaz Ahmed Saab, who recently opening the heart hospital, 200-bed heart hospital. That's very good. Dr. Ijaz Saab, you're on board.
All right, I have to step out. I'm so sorry, everybody. I mean, thank you so much. I learned a lot, and I have to go.
We got it, Sara Saab.
Inshallah.
Thank you very much for participating. Thank you.
Yeah, no, and really, everybody, thank you so very much. So, bye. I'll see you, inshallah, I'm sure.
Sir Amir Ehsan from San Antonio.
Assalamualaikum. This is really very exciting to listen to all wonderful, talented people here. मैं चूंकि किसी भी गवर्नमेंट की टॉक हो रही तो क्रिकेट के बगैर बात नहीं हो सकती, तो मैं आपको 20, 25, 30 साल पहले लेके जाता हूँ जब जहांगीर खान जो है वो every year he used to be a champion, और पाकिस्तानी क्रिकेट टीम जो है it used to be a failure. तो मुझे बचपन की बात याद है कि जहांगीर खान एक दफ़ा टीवी शो पे आए थे, तो उनसे पूछा गया था कि क्या बात है कि आप इतने सक्सेसफुल हैं और पाकिस्तानी टीम जो है इतनी सक्सेसफुल नहीं है। तो उन्होंने एक जो बात कही थी वो मेरे दिल में हमेशा रही, उन्होंने कहा कि मैं अकेला खेलता हूँ। तो आई थिंक ही वाज रेफरिंग टू द लैक ऑफ इंस्टीट्यूशनलाइजेशन इन पाकिस्तान। पाकिस्तान में कभी माइंडसेट वो नहीं रहा कि हम जो है वो हाउ वी नीड टू ग्रो एज एन इंस्टीट्यूशन। जो डॉक्टर नसर ने बात की ना कि हर कोई 1.5 इंच की मस्जिद बना के चीज़ें कर लेता। सो दैट वाज जस्ट माय इनिशियल थॉट। मगर बहुत सी चीज़ें हैं पाकिस्तान में जो कि पॉजिटिव हो रही हैं और जो कि दुनिया के किसी मुल्क में नहीं होती। फ्री कैंसर पेशेंट्स का इलाज अनहर्ड ऑफ इन यूनाइटेड स्टेट्स। किसी से भी बात करें कि व्हाट, हाउ कैन यू ट्रीट 100% फ्री कैंसर पेशेंट्स, फ्री आई क्लिनिक्स, फ्री कॉर्निया ट्रांसप्लांट, फ्री आर्टिफिशियल लिम्स, लोग ये सब कर रहे हैं पाकिस्तान में। Trauma center free. There are so many free things going on in Pakistan. So much positive things, right? जो डॉक्टर नाहिद उस्मानी की स्लाइड्स थी वो बहुत ही आई ओपनिंग स्लाइड्स थी। प्राइमरी केयर रोल इन पाकिस्तान, दैट्स गोइंग टू बी रियली अ बिग माइंडसेट चेंज ओवर देयर। लो हैंगिंग फ्रूट्स हैं। यहाँ पे भी मैं आई वर्क फॉर द फेडरल गवर्नमेंट, और बिलीव मी फेडरल गवर्नमेंट इज द सेम एनीवेयर इन द वर्ल्ड, वेदर इन यूएस और इन पाकिस्तान इज द सेम। जो डॉक्टर नसर ने बात की, हाउ टू पार्टनर द प्राइवेट एंड पब्लिक पार्टनरशिप, आई थिंक दैट्स वेयर द की इज। हम लोग जो है प्राइवेटली हर चीज चेंज नहीं कर सकते, फेडरल गवर्नमेंट हर चीज चेंज नहीं कर सकती। इट्स द कॉम्बिनेशन ऑफ बोथ एंड हाउ टू क्रिएट दैट मॉडल। सोशल मीडिया इतना प्रेवलेंट है, टीवी शोज इतने होते हैं, आई विश कि हम किसी भी शो में एक कोई पब्लिक अवेयरनेस का मैसेज दे दें। ब्रेस्ट कैंसर की स्क्रीनिंग हो, पोलियो का हो।
मुझे तो फोन दो। यस,
जितनी ज्यादा हम पब्लिक अवेयरनेस करेंगे मीडिया के थ्रू, दैट्स गोइंग टू रीच आउट टू मैसेज, राइट। मेरे 2-3 चीजें बस मैं ऐड करना चाह रहा था जिसमें एवरीवन कैन मेक अ बिग इम्पैक्ट। इज प्राइमरी केयर, डेफिनेटली हम बहुत ज्यादा पैसे खर्च करते हैं कैंसर सेंटर बनाने में और दिस एंड दैट, but we are having very limited resources or targeting screening that just already discussed हो चुका। trauma center की बहुत ज़रूरत है पाकिस्तान में। people are dying, there is no concept of 911 या immediate life saving। डॉक्टर मिस आयशा अली ने जो है वो बात की इसकी ब्लड बैंक की। my expertise in blood bank, that's also one of the major, not the only, but one of the major factor for transmitting certain diseases which can be avoided। और जो टैलेंट यहाँ पे है इसको किस तरह टैप किया जाए, इसको हम लोग पाकिस्तान जाके कुछ भी नहीं कर सकते। हम एक डायरेक्शन दे सकते हैं। पाकिस्तान के जो लोग हैं वो देयर इज ऑलवेज गोइंग टू बी एन एटीट्यूड बिटवीन यूएस एंड नॉन यूएस, वेस्टर्न नॉन वेस्टर्न, बट हाउ टू वर्क ऑन institutionalize the talent that we have, whether in Pakistan or anywhere else, is really the challenge, not only in healthcare, but every institution in Pakistan. Thank you.
Thank you very much, Mr. Dr. Amir Hassan. You are really philanthropist. You doing a lot of good thing, and you can really bring a lot of experience. And that's the one more important thing I discussed in your event, that if in Pakistan all the pathology is certified according to the world standard, I think not. Okay, that's a very, very important, that all the pathologies should be certified according to world standards. Okay, that we'll talk later on. Now I have with me Dr. Asma Qayyum. She is specialized in infectious disease. Dr. Asma, are you on board?
Gee, I'm here. Very interesting conversation, actually, and people have hit upon just the right things that need to be addressed, but there are so many of them that we have to tackle with. And just starting off with what Adil also mentioned, I think as far as Aisha Ali said, these programs are there, but they need a basis on which to build upon. We don't have that infrastructure to then to be able to channelize everybody's energies and the monies that we collect, so that even though a lot of pro bono work is being done in Pakistan, I don't know how consistent and connected it is most of the time, simply because of the availability of funds. So I don't think we as such from the US can help build the infrastructure, but certainly we can build upon that. So there's an adage in infectious disease that we work with, which is called prevention as treatment. And prevention is the key. We can build hospitals like the one the gentleman was going to talk about, the cardiac hospitals or the oncology. The screenings are most important, and that's where primary care comes into being. As far as the artificial intelligence is concerned, or even technology, everybody has a cell phone, as Dr. Sana mentioned. Just the awareness, public service announcements that, prevention of malaria and dengue, stagnant water would, just basic things. So it seems like a tremendous opportunity, and at the same time, a huge undertaking. But as through public service announcements, a lot of these things, or a lot of these programs can be instituted. And again, for those, we will definitely need the local governments to help. And as you said, not at a federal level, but at a local level, since we do have these tehsils and the smaller hospitals that then are the catchment areas for people. Case in point is one of the things that we did, and we are planning on working continuously with, is the diabetes, as Dr. Nahid Usmani mentioned. That is prevalent in Pakistan. So we have a small app that at Apni, and on a smaller level, we contributed money to them. So the local nurses have been giving that input, and the local healthcare workers have been giving us that data, and the diabetes A1C is being managed by an endocrinologist, and she can then keep giving, the treatment and monitoring the dosages of the medicines that are needed. So on a microcosm level, that is a small program. Similarly, the other similar programs can be instituted. So, universal healthcare certainly is there, but then again, you come back to the prevention as treatment. So all of these things can add up over time. Instead of top down, we need to work from bottom up to be able to make these programs stick. And at the same time, as you said, for them to meet. So at some point, we have to stop treating and start preventing for these to come in parallel and for the greater good of Pakistan. So that's my 2 cents after talking to and listening to all of you. Certainly we are all intelligent people, we know where to go, but we would love that the government would step in also and do what it needs to do.
Thank you, Dr. Asma Qayyum, and your contribution and your words about Pakistan healthcare. And now I would like to invite the Commercial Councillor, Mr. Talat. What are the opportunity of investment in healthcare industry in Pakistan? Talat sir.
Thank you very much, Waqar sir, for inviting me and for arranging this event. It is really very useful. As far as investment is concerned, health sector, as has been elaborated by Consul General in detail about the overall dynamics of the health sector in Pakistan and by the other speakers. Health sector primarily now is after 18th Amendment is with provincial governments. There are huge gaps between the provinces as well. The role of the diaspora and the investors can be there is still a large gap. It is not that the government is not doing enough, but government is not doing enough keeping in view the population explosion. We have the primary health system, like for example in Punjab, there is a network of basic health units. Primary health care consists of two basic tiers. First is basic health units, then are the rural health centers. Then comes the secondary health system. Secondary health systems consists of the Tehsil headquarter hospitals and the district headquarter hospitals. And finally is the tertiary care hospitals. Say for example in Punjab, we have 44, 45 tertiary care hospitals. But the number of the people that visit these hospitals and healthcare centers, they are far more than the capacity of the physicians and the health facilities over there. So the role of the diaspora and the foreign investors comes in. There's a huge scope of the foreign investment in the health sector, particularly at the district level, as Dr. Ejaz Saab has just told us that he is setting up an hospital of 250 beds in Gujranwala. There is a sure recipe for success of any venture of foreign investment in the health sector, because the demand is far more than the supply sector. Same goes for any facility that caters to this hepatitis C. It is huge, primarily because of the public attitude, primarily because of the drinking water, and we still are, although we are in 21st century, but still there are unhygienic practices and the shavings and all that, and their dentistry at the lowest level, they are contributing to this hepatitis C issue. And a large number of medical tourism is going from Pakistan to India and China for treatment of liver and liver cirrhosis, etc. Government has established a liver and kidney and PKLI Kidney and Liver Institute in Lahore and set up satellite stations elsewhere at the district level, but that is far less than the demand. So I would suggest that our diaspora, the people, really mobilize the investors to come in and move to Pakistan. Pakistan is a very investment friendly regime. Government has a lot of incentives. Our consulate, under the leadership of our Consul General, we are there to facilitate any investors. We are there to connect to Board of Investment, to the Security and Exchange Commission of Pakistan, and any provincial governments, provincial boards of investments. So I would like to request that we all need to work for mobilizing investment in the health sector of Pakistan to fill the gaps between the demand and what the public sector is doing. Thank you once again, Waqar.
Thank you, Talib Saab. Is Shahid Saab here or gone?
Is Shahid Saab nahi hai.
ठीक है. तो एक्चुअली माशाल्लाह बड़ा अच्छा ये राउंड अप मीटिंग रही आज, और ये मैं बताता चलूँ क्योंकि मैं पाकिस्तान काफ़ी जाता रहता हूँ. पाकिस्तान में काफ़ी बड़े बड़े हॉस्पिटल हैं जो बहुत अच्छी खिदमत अंजाम दे रहे हैं, जिसमें डायलिसिस सेंटर है, आप जानते हैं डॉक्टर अदीब रिजवी को, ठीक है, और वहाँ पे जो इंडस हॉस्पिटल है वो भी बहुत बड़ा काम कर रहा है. नफीस नागी साहब नहीं आ सके. ही वाज बिल्डिंग द शमीम एंड नागी कैंसर हॉस्पिटल विद द कोऑपरेशन विद द इंडस hospital, which is called Jubilee Center in Lahore. Okay, so there's a lot of very big hospital built by the NGOs and diaspora in Pakistan. और अब करना ये है कि क्योंकि कौंसल जनरल साहब यहाँ पे मौजूद हैं, और हम चाहेंगे कि एक जनरल मीटिंग हो जिसमें हम ऐसे लोगों को इनवाइट करें जो इंटरेस्टेड हो पाकिस्तान में हेल्थ डिलीवरी में हेल्प करने के लिए. जैसे डॉक्टर सुहेल मसूद ने कहा कि he can really create a concept of treating patient at home. You know, that's a very good idea, and he's a very established person. You know, Dr. Nahid Usmani की जो ब्रीफिंग थी और जो उनके पावर पॉइंट था वो भी बहुत अहम था, और डॉक्टर आयशा अडी साहबा ने जो पूरा एक कंप्लीट प्रोफाइल दिया पाकिस्तान के व्हाट्स गोइंग ऑन, व्हाट थिंग टेकिंग प्लेस, दैट इज वेरी ऑसम. And I'm really thankful to everyone who participated today's. Dr. Hamid Saab, you're all the way from San Antonio. Saima, you're from Asma from Boston, and Dr. Sohail Masood Saab, Dr. Nathar Qureshi. Is Nadeem Salim is gone? Is here? Nadeem is gone because he is with family today. So now the closing point, I would like to invite once again Aisha Ali, our Consul General Pakistan, to say everybody thank you, the closing remarks, and then Jamal Khaja, you to come. Yes, Aisha Ali.
वकार साहब बहुत शुक्रिया, थैंक यू सो मच। मेरे ख्याल में बहुत जैसे बाकी स्पीकर्स ने भी कहा कि बहुत एक यूज़फुल डिस्कशन है, बहुत यूज़फुल डिस्कशन का एक्चुअली आगाज़ हुआ है आज। इट्स इम्पोर्टेंट टू कंटिन्यू टू हैव दीज कॉन्वर्सेशंस। For me, one of the biggest takeaways is the interest in primary care. क्योंकि जब मैं इस मीटिंग और इस वेबिनार के सिलसिले में मैंने कुछ पाकिस्तानी हमारे जो यहाँ पर फिजिशियंस हैं उनसे मेरी बातचीत हुई, तो उन्होंने कहा कि जी डायस्पोरा, एंड आई हाईलाइटेड द प्राइमरी केयर, मैटरनल, चाइल्ड केयर इशूज़, तो उन्होंने कहा कि जी डायस्पोरा का या फिजिशियंस का यहाँ पर कोई इंटरेस्ट नहीं है इन चीज़ों के ऊपर। मोस्टली सोशल वेलफेयर प्रोजेक्ट्स या चैरिटी या कोई कलामिटी के सिलसिले में मदद होती है, but if you're talking about a sustained effort and to help the policy interventions in Pakistan in this particular sector, तो आपको इतना interest यहाँ नहीं मिलेगा. But I'm really very pleasantly surprised, Dr. Usmani, by your presentation, and I can see that Apna has already taken the initiative and it's on its way, जैसे कि कहा जाए कि इस सेक्टर में भी अपना एक इम्पैक्ट क्रिएट करने के लिए आपका बहुत शुक्रिया. And the other big takeaway for me from this meeting is the role of technology. And I think कि developing countries के लिए हमेशा एक ये challenge रहा है, ये जो gap होता है between resources and their needs. और चूंकि हमारी population एक बहुत बड़ी population है, तो I think as Dr. Sana from I think California, he very rightly pointed out that technology is actually really the future, और इसको definitely explore करने की ज़रूरत है. And in terms of IT, तो हम भी देख रहे हैं कि पाकिस्तान में भी बहुत उसकी पोटेंशियल है, और बहुत सारे उस सिलसिले में भी हम वेबिनार्स कर रहे हैं, लोगों को एक दूसरे से कनेक्ट कर रहे हैं. सो टेक्नोलॉजी फॉर मी अगेन, जब उन्होंने इस चीज़ की तरफ तवज्जो दिलाई, तो आई थिंक दैट्स गोइंग टू बी बिग in the future, and that's also where our diaspora and the government of Pakistan can, I think, work together. Preventive care, again, जैसे डॉक्टर आसमा ने कहा कि उसके ऊपर कोई फोकस नहीं है. Again, since I've been living here, और आप लोगों से बातचीत रहती है, तो इस चीज़ का बहुत एहसास हुआ है कि उसके अंदर भी इन्वेस्टमेंट करने की ज़रूरत है. आदिल नजम साहब से about the controversy recently regarding the Dr. Sahab, you're absolutely right, but such is the nature of politics. आप कहीं भी दुनिया में देखें, पाकिस्तान में भी extremely partisan है, और बहुत ज़्यादा extreme positions कुछ issues के ऊपर ली जाती हैं. And unfortunately, मैं नहीं समझती कि ये कोई diaspora की खिदमात को recognize ना करना या उनको the way in which a particular person was treated, maybe equal policy, it's not a part of the policy of any government of Pakistan. I think कि हम सब हमारा diaspora जो कहीं भी है, overseas communities, उनको हमेशा से बहुत acknowledge किया गया है, recognize किया है. And at the same time, I also want to say what Dr. Qureshi mentioned कि government को कोई replace नहीं कर सकता. Government in itself is a gigantic big thing जो कि each and every aspect के लिए responsible होती है. Diaspora obviously plays a very important role. We're very grateful. You are one of the best brains of our country. We're very proud of you, very proud of your achievements. Look forward to your contribution in health and other sectors. But obviously the government would, inshallah, continue to play its role. If you ask me personally, and this is my personal opinion, we need to spend much more on health. In terms of the percentage of our GDP, अगर कोई एक real change हमने बहुत जल्दी इस field में देखनी है, तो ये करने की ज़रूरत है. And I think the government is setting the agenda. The government has its priorities right. और राइट चीज़ के ऊपर सोशल वेलफेयर एंड सोशल डेवलपमेंट एंड ह्यूमन डेवलपमेंट के ऊपर जिस तरह का फोकस आजकल में देखा जा रहा है since the government has taken since the new government has been formed, I think this is something very different. It is very obvious from the number of Ehsaas programs that have been launched, and I think it's a new kind of a government, a new kind of a start. There, of course, needs to be a continuation of the policies जो earlier government की भी थी. हर government अपनी एक contribution करने की कोशिश करती है, and we need to build on that. A lot of good work has been done, and a lot still remains to be done. And this is where we look forward to your continued partnership with us. Again, at the end, very grateful for your time, very grateful for your contributions, and based on our conversations, we always send these recommendations back to the concerned ministries. We've connected so many people here and so many of our diaspora to the concerned and the right ministries to take this whole process forward. Investment ka ho ya tourism ka hai, health ka hai, kisi bhi sector mein. And the Consulate General of Pakistan takes a great deal of pride in taking this whole process forward. I look forward to staying in touch. Thank you, Talat, also for your contribution. You made some very important and useful points. Waqar Saab, Jamal Saab, everyone, thank you so much.
Thank you very much, Consulate General Sahiba. आपने हमने बहुत सारे वेबिनार अटेंड किए हैं, but I must, and I'm not trying to patronize you here, but you did very well. मैं ज़रूर 2-3 चीज़ें करने के लिए ज़रूरत है हमें कि यूनाइटेड हेल्थ केयर ने हमें सपोर्ट किया है इस प्रोग्राम को पेश करने के लिए. So I want to thank them. I want to thank everybody. But 2-3 चीज़ें जो मैं नोट कर रहा था और शायद इस पे रोशनी डालने की ज़रूरत है कि अगर कुछ नहीं करते उस बारे में अगर बात कर लें तो 50% तो प्रॉब्लम सॉल्व हो सकती है. So I do feel very good being a Pakistani American that we are talking about it. All thanks to Waqar Ali Khan साहब, OPTV, कि हम इस चीज़ को हाईलाइट कर रहे हैं. देखिए हम डॉक्टर नहीं हैं, वकार साहब डॉक्टर साहब नहीं है, लेकिन यह है कि हम इन चीज़ों को ला रहे हैं. द कंसर्न पीपल जैसे हमारे सुहेल मसूद साहब हैं, आमिर भाई हैं, ये ज़रूर लग रहा है कि पूरा वर्ल्ड जो है वो अब पाकिस्तान को डिफरेंटली देख रहा है. और इसमें 101% हमारी सबसे पहले शाह महमूद कुरैशी साहब की बहुत ज्यादा काविशें हैं जिसकी वजह से पाकिस्तान को हर प्लेटफॉर्म पे रिकॉग्नाइज किया जा रहा है. हम कभी भी मीडिया में, कभी भी जूम मीटिंग्स में कभी अपने प्राइम मिनिस्टर को, फॉरेन मिनिस्टर्स को, हेल्थ मिनिस्टर्स को नहीं देखते थे. बट नाउ इट हैज शिफ्टेड. Recently, me, Waqar, couple of other people were recognized by Shah Mahmood Qureshi Saab, the foreign minister, for doing working during the COVID, and it was amazing. हम कोई इसलिए काम नहीं करते, कोई पाकिस्तानी इसलिए काम नहीं करता कि उसे तमगा चाहिए, बट हर को अच्छा लगता है कि जब रिकॉग्नाइज करे. तो ऑन बिहाफ ऑफ OPTV पाकिस्तान से आगे यूनाइटेड हेल्थ केयर, मैं आप सबों का शुक्रिया करना चाहता हूँ. वकार भाई, ओवर टू यू.
Yeah, thank you very much, Aisha Ji, giving a valuable time. Dr. Suhail Masood साहब, माशाल्लाह आज तो आपने मेरा दिल खुश कर दिया डॉक्टर सुहेल मसूद साहब. और मैं चंद लोगों का शुक्रिया अदा करूंगा जिसमें डॉक्टर सुहेल मसूद is one of the pioneer who really helped me get started the TV Pakistan. Then TV Pakistan become a Safir Pakistan. Then Safir Pakistan is become a really lifetime partner with Apna. I think I'm the only one who's received the Lifetime Achievement Awards by Dr. Samad in San Francisco about my services. And of course, Dr. Amir Ihsan is also recognized in services. And Dr. Suhail Masood is one of the main directors of the OPTV Global. Dr. Nasser Qureshi, he's really took me 2-3 times to Pakistan with the Dow Medical group. And I really did a documentary on King Edward's 125th anniversary. I was in Pakistan with them. So I did a lot of work with Apna. And let me tell you today, I have to give you this news. I am the one who put together a bridge between Open and Apna. Okay, I am the one who introduced Dr. Naveed Shirwani and Apna, and then that meeting took place. The Open people come to in the Apna meetings. and Apna had a very good MOU understanding. So I have this credit on my career that I made this movement, because a lot of doctors has a lot of money, but they have some kind of a technology and some invention, but they need some technologist, and which is the Silicon Valley. You have really be surprised that a lot of entrepreneurs doing a lot of biomedical engineering in Silicon Valley. They're not seeing that product, but their product all over the world. So this is a good start with the open and Apna collaboration. It should be continue. Dr. Nasser Qureshi, you always my mentor. Dr. Suhail Masood Saab, you always patron. Amir Qureshi Saab, you always a good friend of mine. Adil Najim Saab, thank you very much. First time I interacted with you, and I hope we'll make more contact with you. Talat Saab, inshallah, we'll be in touch with you. And again, thank anyone want to say before closing this Zoom meeting?
वकार भाई बहुत बहुत शुक्रिया बुलाने का, बहुत interesting, and I really thank Dr. Aisha Ali. I think she and I are on the same page. There are a lot of efforts being made. Pakistan is progressing, and I think the diaspora has a unique role contributing, and it has to be in education and developing primary care, etc. So Dr. Aisha Ali, we are with Pakistan and the healthcare sector there, inshallah. You know, good times are to come.
Just as a last remark, Waqar bhai, if I can.
Yes.
So first of all, I would like to thank you for inviting and putting together. I think it's probably one of the more empowered and learned panel that I've recently seen in any of the Zoom meetings that I've been on.
Thank you very much, sir. Very
Bahut bahut shukriya. And of course, your comments and detailed remarks, Council General, were greatly appreciated, and we all learned something regarding the direction Pakistan is going, and we wish and pray to Allah that we actually are able to achieve it. And as Nahid, I'm sorry, you call her Dr. Osmani, but I just call her Nahid because I just know her so well, has said that the diaspora is there as far as we can, as if we can somehow or the other achieve impact, and that impact, as you recognize, has to come by within a governmental infrastructure. I think one thing which one of the participants said, I don't remember who, Shahid Api ne kahi thi ye baat, the human capital development is extremely important and necessary, because aap feed karte rahenge, you can build buildings, but if you don't have the human capital to fill them up, even for the private entrepreneurs who are putting in healthcare in Pakistan, shortage of doctors and trained nurses and trained technicians and at every level is tremendous. So my only suggestion would be that the group that has been put together, maybe not on a webinar, but just as a small group meet and see what we can do for Pakistan government, irrespective of who the government is, the politics aside, and come up with some kind of a thought group or a think tank. I hate the word think tank because they don't do anything. They tell you what you already know.
Well said, sir.
So, but if we can contribute as a group to development of healthcare in Pakistan, I think everyone here would have it would be their pleasure. Thank you so much, and thank you again, Waqar bhai, for putting this together.
Keep watching OPTV Global, which is the first and only channel advocacy for overseas Pakistani Americans and overseas Pakistani globally, inshallah, and we'll provide very good connectivity service to the Apna as well. And as you know, always there. Thank you, Dr. Saab, Suhail Masood Saab, बहुत शुक्रिया. आपकी शिरकत का
सिर्फ आपका शुक्रिया अदा करना चाह रहा था. You know, I know you since 1995.
Yes.
And आप बहुत मेहनत करते हैं. You always have the right intent. You work very hard. You bring everybody together, and I just want to make sure that people understand that these things really don't happen in vacuum. Somebody has to work hard, and somebody has to put time, money, and effort to do it. And alhamdulillah, you have been doing it. I know you since 1995, like I said, and I've always seen you do it with wholeheartedly, and you do it without any politics and without any personal need and whatever other ambitions people have. So thank you very much, and I invite the Consul General to come to Boston and hopefully spend some time with us, and also hopefully think about home infusion, because I don't know if you understand this industry, but this is making a lot of change in America, and this can make a lot of changes in Pakistan, whether I do it, somebody else do it. But home infusion is a way to go in the future. All these new drugs coming out, they're all injectable drugs for diabetes, for hypertension, for high cholesterol, and they cannot be just dispensed through a local pharmacy. Somebody has to train those patients to infuse those drugs. All these monoclonal antibodies and all kind of things coming out are all injectable. So technology and healthcare are going to have a beautiful marriage. And if Pakistan doesn't accept those ways to do it, where we can do it 1/10 of the cost of going to the hospital, then it won't happen.
Thank you, Dr. साहब, बहुत बहुत शुक्रिया आपका. और आपको जैसा मालूम होना चाहिए कि my very important book is coming, and I'm really introducing the most important people in America and their contribution in health, technology, medicine, intellectuals, IT, finance, environment. You know, this book is almost there. In January, I'm going to be releasing this. The book is the most influential Pakistani American in US, and that is the level above all my about 30 years work in that.
कोई प्रोग्राम ऐसा बनाए ना कि हम सुहेल मसूद साहब जैसे लोगों को पाकिस्तान घुमा के लाते हैं.
We are really planning on March 20th to go Pakistan. 21st of March, we are planning a delegation to take this bridge group to Pakistan.
I haven't been back since 1984. So
wow.
So Dr. Sohail bhai,
for you, Pakistan would be a new place to be.
आदिल नजम साहब, आपने भी हमारे साथ जाना है पाकिस्तान. और आमिर कुरैशी आपने भी जाना है. नाहिद आपने भी हमारे डेलीगेशन में जाना है. Amir Hassan. Or we are planning this delegation is very important. We're taking only top 20 Pakistani Americans on a different kind of trade and industry, inshallah. मुझे उम्मीद है कि नाई साहब हमारे डेलीगेशन में जरूर शामिल होगी. और बॉस्टन, देखिए बॉस्टन is always the important place, always center of many things. Boston. Okay, thank you Adil bhai, thank you Amir bhai. Anything want to say?
Thank you.
Thank you, Ji. Thank you everyone.
Thank you.
Adil bhai, I'll make sure that you are on board with us to Pakistan. आपका जाना बहुत जरूरी है.
आपको तो लेके जाएंगे जबरदस्ती.
Okay, Allah Hafiz everybody.
Thank you very much. Really, I'm very honored that you are on board with us.